Wikidontists.com. Truth about tooth.
Good morning. Today we are going to talk about lingual orthodontics. There is a lot of requests from my viewers and people like that on comments that they'd like to know more about lingual orthodontics, because that's also another possibility. So what is lingual orthodontics? Lingual orthodontics is when the brackets are actually fixed on the lingual side of the teeth or on the palatal side of the teeth. See, when it is on the tongue side, it is not visible from the front, so it look as though you have not done any treatment and you are just smiling. When you open your mouth only, you will be able to see some of the brackets at least. So that is the good thing about lingual orthodontics. The beauty about it is we can actually do some crowding corrections. If you have some spaces, we can actually correct that. All those things can be done with lingual orthodontics, and it has been a great tool in orthodontics to do lingual orthodontics. We have done a lot of cases with the lingual orthodontics. There are a lot of companies which is doing lingual orthodontics with even customized brackets are coming for lingual orthodontics. It can be, it is very simple, so it is now done in a customized way, wherein you make the impression, send it to the company, then they will give you all the brackets ready on a tray, so you don't have to keep the mouth open and then you have to stick painfully all the brackets, and even the position of the bracket will not change. So it is like an aligner. They will set it on a tray, and then we load all the bonding material, and then we can actually place it on the tooth and then just light cure it, and then the whole brackets are actually fixed. So there are options like that, they customize the bracket placement also. So it is all done outside, and then it is kept, and then we can correct the problems with your malocclusion with lingual orthodontics. What is the negative side of it? Actually, your tongue is on that side. That is why it is called as lingual orthodontics. We are actually put it on the tongue side of the tooth. So the problem is there will not be any rotation for your lip, but there will be some or very good rotation for your tongue. So first few days it is very difficult, and especially if something is broken, then it is very difficult for you, because the tongue space is actually encroached by your bracket and it is actually moving the other way around. So, and second thing is, actually if you have to do a lot of orthodontics, it is much better to do it from labial side. As you know, it is from push, it is actually becoming a pull treatment. So from there it is much more difficult to increase the anchorage, to do some amount of treatments. It is very difficult, but you can get a moderate to mild to moderate cases can be treated with lingual orthodontics, and it is very effective in that sense. But why did lingual orthodontics fall out of all these best treatment line? Is actually because of why did lingual orthodontics came into being is basically because of the aesthetic part, because all the metal braces used to show so much, so lingual orthodontics used to be very conspicuous, and that is why it came. But now we have other options like ceramic orthodontics, which is little conspicuous, but we have even better option that is called as aligners and Invisalign, which is actually very easy to maintain. There is no irritation for the tongue and things like that. So since there is a option for aligners, the lingual orthodontics has actually been phased out of the mainstream orthodontics, but still we can do lingual orthodontics. There are a lot of requests from my viewers to understand more about lingual orthodontics. That is why this video. It has been effective for minor space closures, for correction of some of this malocclusions, which is actually for correction of rotations and things like that. It is very effective, but the problem is actually we need to activate it every now and then, because the range of the wire, because when you look at the teeth from the inside, actually the circumference is lower, so the range of the wire is low. So the brackets are even closer to each other, so the length of the wire between the brackets is smaller. So what happens is the flexibility is even more smaller. And second thing is, if something breaks, if you eat something hard and if it breaks, it's very difficult for the orthodontist to keep it back, and you won't know, because in the front at least you will see something dangling. Only thing is you might not know about it until the tooth moves out of the place, or the back bracket really moves really fast, or if it is actually irritating your tongue, you will come to know. Otherwise you will not come to know. So it needs a very regular checkup rather than in other orthodontic materials or even in aligners. And the last thing, which is actually the problem, which is the cost. So cost is almost equivalent to the aligner cost, because the aligner companies are actually reducing the cost to make it much more popular. So the aligners have actually taken the space of lingual orthodontics, but lingual orthodontics is a very good treatment plan for some cases. So we are still doing some lingual orthodontics for the patients who are aesthetically very conscious. So thank you very much for watching. If you haven't seen the my video for the first time, please make sure that you see all the videos which has been posted. So there is a lot of dental videos which is talking about orthodontics and endodontics, your prosthetics, and how to do your oral hygiene really well, what not to do, what to do, and all those things. So please subscribe. I am there on Instagram and Facebook. If you are a user, please make sure that you follow and like my videos, and go to the page and like and subscribe all the videos, see all the videos, so that you can understand more about dentistry and more about what I do in Kochi at my clinic at Marine Drive in Kochi. I am Dr. Thomas Nechupadam. Thank you. Have a great day.
Wikidonist.com. Truth about tooth.